Thank you for coming. I do just need to say thank you very much to a charity called Genetic Disorders, or Genes for Genes. They actually gave us a grant to help put on this conference this year. So I need to say thank you to them, and I'll be writing about them on Facebook and Twitter just to say thank you, and we'll put some photos on there. If you have any questions at all about today, anything that you need, please just come and ask me, and I'll try and answer the question or try and do what I need to do to help. I hope you have a fantastic day. I really look forward to today, and I really look forward to seeing you all again. So have a great day. I'm going to briefly hand you over to Tracy, who's the Chief Executive of the Wolfram Syndrome UK Support Group. She'll tell you briefly about what these guys are doing today, and then we'll move on with the presentation. So have a fantastic day, and I'll speak to you all later today. This is just a quick one. You've probably seen when you've been having your teas and coffees next door, we've got some items for sale. We've got some bags, we're taking orders for polo shirts, we've got Christmas cards, and we've also got a raffle. So please have a look when you're having your tea break. Come and have a look, buy. All the money is going to go towards the charity, which is obviously going to help you. Thank you. That's all I say.
What I wanted to do, first of all, was to talk briefly about the clinical service, because many of you will have now experienced it there. Tell you really what we've tried to do to develop it, and also try and get your feedback really about what you want from the clinical service in the future, because this is your service, and you need to say what it is that you would find most helpful for this. So I wanted to spend about 20 minutes or so talking about the clinical services, and I'm presenting on behalf of my colleague Karen Morrison, who sadly has been taken ill, and yesterday was her last clinic for a bit, so she's asked me to give her apologies and present on her behalf here today as well. I should do that. I have got some slides, so for those of you who can't see, I apologise, but I'll talk through the slides as I'm going. So first of all, as you know, we're very lucky to have a national health service in the UK, which delivers all of the services at the moment, but it's had a big reorganisation into the way it's been funded recently. So now, since last April, general practitioners and primary care is all funded by clinical commissioning groups, and they'll do your everyday services that you want. Anything that you need that goes into hospital and more specialised is now looked after by what's called NHS England, and this is the body that actually decides what special services can be had. There are about 5,000 rare diseases like this one, but we haven't got enough money for 5,000 separate services. So we're very lucky to have the funding for a rare disease service for Wolfram syndrome, and NHS England are the ones who've given us the money to do that. So we have to spend that money wisely and deliver the service that you, as people, want from it. So the clinical support that the government has given us for is for clinics for people with Wolfram and related conditions on 2 sites at the Queen Elizabeth Hospital in Birmingham and Birmingham Children's Hospital. And the background to this is that we've had to define what we're here for. So this is for children, young people and adults and their families and carers with this disease, to try and help coordinated care in one place by health professionals who've met other people with the condition and will develop some experience of it, and trying to address the medical issues, psychological things, and some social and educational issues as well in this condition. And it's not to take over the local care, but to try and support local teams who might be looking after you, wherever you are, whether it's Devon or Hull or Scotland or wherever. And to do this at the moment, we've got enough funds to do 4 children's clinics a year, and about 3 adult clinics a year, and potentially an outreach clinic elsewhere if we can. So not a lot, but at least as a start. And it's a partnership between Birmingham Children's Hospital, the Queen Elizabeth Hospital in Birmingham, which is the adult hospital, and the children's charity Well Child, which is there to provide support as a family liaison, but because of their remit, it's really up to young adults at that age. And then also the genetics laboratory, who will do the genetic testing for this condition. So that's the partnership who it is. Any service in the National Health Service now has to cover 5 different areas. Every service has to try and prevent people from dying early, trying to improve quality of life for everybody with a long-term condition, trying to help people recover from episodes of illness, trying to make sure that people have a positive experience of their visits to hospital and care, and trying to look after people in a safe environment and protecting them from harm. And this is the new way that the NHS is going to try and specify all of this to make sure that people have the best experience of the care possible. The service itself has got to have set outcomes that we've got to try and deliver, and we've got to try and actually help people to have as good a quality of life as possible. And you might notice, those of you that come to the clinics, that you might start being asked some questionnaires about that, some by Rachel and some by Marie McGee and others, about your how your quality of life is and how that's changing. Secondly, we're trying to help that diabetes care to be as good as absolutely possible, and as you know, we measure that with glycated hemoglobin and others. So we're keen to try and support with the best possible diabetes care available. And I met some young people yesterday who are on insulin pumps, which is fantastic, and we're going to be looking at what sort of pumps will give the biggest readout to actually help people see what there is. And indeed, we had a conversation yesterday about talking insulin pumps as well, which will give an audio readout. And so as the clinics develop, we're going to try and get these sorts of images into there as well. The other side is also kidney function, and we're trying to make sure we're monitoring that, so that's going to be kept as good as possible. We're trying to support you to make sure that you get screened for diabetes insipidus every couple of years, that we develop guidelines for how to look after people with this condition, which is with our colleagues in France and Germany and everywhere else as well. For anybody who's over 15 years and adults, to look for neurological complications to help. And what we hope is that we can look back in 5 years' time and we can see new people coming to the clinic who had a diagnosis much, much younger and didn't have a long delay in getting the diagnosis that other people have had. And then finally, Rachel is working on a family outcome tool to look at the effect on families and how we can support families better with people living with people with this condition in the UK. So the clinics at the moment are a multi-disciplinary clinic, and is to try and have people who are experts in diabetes, for neurology, urology, clinical psychology, and genetics and counselling particularly. And as far as we can, linking in with clinical scientists in the laboratory who can do genetic testing if it's not being done, a nurse specialist who can be there to support young people and adults with their diabetes or their genetics, and a research nurse to let people know about what's going on in terms of research for Wolfram and invite them to take part if they want. And that's the model that's being funded for the Children's Hospital and the Queen Elizabeth Hospital. Those are the two. So the teams at the moment, if I start at the Children's, the clinic coordinator is Leslie Porter. Is Leslie here at the moment? No, she'll be coming in a bit. And Karen Albert. And they're the people who, if you phone the Children's Hospital and ask to speak to Leslie Porter, she'd be the point of contact if you've got a question about your appointments or those sorts of things, and so would Karen. Marie McGee, who's on holiday this time, she came last year but couldn't come this time, is there to try and help look after young people as they move from children's services to adult services at the Queen Elizabeth. And she's developing tools and other visits to help people move between hospitals conveniently. Handheld folders for you to have and take with you, which we're hoping to do for people with Wolfram, which is a record of all the clinic letters that you've had and all your results and all the contacts of who you contact if you need some advice about particular areas. And then we're keen to roll those out over the next year for the clinics. Coming this afternoon is our children's neurology doctor, and he's working with our colleagues in University of Washington St. Louis in America, where they're trying to develop a measuring tool to look at neurological complications in walking. And he started to collect some information with a lady called Dr. Percy over there. Denise Williams, I think, is coming this afternoon and is going to be talking, she's our genetics counsellor. John Ainsworth is, Norway, thank you for coming along, fantastic, I'm sorry, John Ainsworth is our ophthalmologist, and we've included. Faiza Nazir is coming as well, and she's clinical psychology. Urodynamics is Liam McCarthy, who was here last year, and Catherine Lambden, who's also here as well. Can you just stand up, Catherine, briefly? Catherine, thank you, Catherine. She's our research nurse, and she will be telling you about what research studies can be going on. Rachel Bates, you've already met from Welsh Heart. At the Queen Elizabeth side, Professor Karen Morrison is an expert in neurological complications of Wolfram and other disorders, and she brings a lot of experience that she's developing to actually get to know young people and adults with the condition, and advise and support with local care and help. Dr. Williams, Denise Williams, covers the adult service and the children's service, and with her genetics nurse counsellor can put you in touch with extra advice about genetics, family planning, effects on other members from wherever you live in the country, because she's got connections with all the other genetics doctors around the country. Dr. Peter Betham is a psychiatry consultant, and he's a very nice man who's been working in the clinic for over a year now. He's really expert. He's understanding mood and the effects of Wolfram syndrome on people's emotions and feelings, and understanding how that might affect those and what other support can be helped locally. And it's a learning process for us as much as it is for him, really, to help that. And then Dr. Rachel Crowley, who again is coming this afternoon, is our endocrine doctor, who's an expert in adult endocrine, and she's an expert in hormone replacement for puberty, male hormones, female hormones, diabetes insipidus, diabetes, thyroid, all those sorts of things. And she works with Dr. Andrew Toogood, who's there as well. So the money we've got from the government is to cover those sorts of basic things to start. You remember, those of you who've been to the clinics, that the adults, they're on a Friday, and we did a clinic for adults yesterday, Friday afternoon at the Queen Elizabeth. And the children's are on a Monday, and we had been doing a clinic all day on a Monday with families coming and staying in the hotel the night before. We're lucky to do it on the clinical research facility because we've got a bit more space, which helps. And we've also got a team of very nice research nurses who can actually help look after you through those as well. What I've asked Rachel and others to do is, if you're going to the adult clinic, to try and let Professor Morrison's secretary know 6 weeks beforehand if there are other specialists that you would want to see at the same time. Because at the Queen Elizabeth Hospital they've got access to skin doctors, chest doctors, urology doctors and others. And if we can do it, we'll try and get them to come along to the clinic as well if you need that consultation. Similarly at the children's, if you let Leslie Porter know, or Rachel know, 6 or 7 weeks beforehand, if you need to see somebody else that we haven't got on our list, then we'll do our best to arrange that. And over the last year we've arranged a skin appointment, ear, nose and throat, chest doctor, gastroenterology doctor. So we can do it as long as there's enough notice to try and help. Okay, so that's that. So, what's the feedback that you've given us over the last year? The big feedback I think that I didn't appreciate from the Children's Hospital end is that you said it's been very, very tiring to see so many appointments all in one day. And I felt really guilty after that. I thought, this is awful. We tried to get you to see 8 different doctors all in one day, and it must be hard work. So what we've tried to do is we tried to spread those out a bit more. First of all, give you the option that you don't have to see everybody if you don't want to, if it's not helpful. Okay. Secondly, spreading them out potentially over 2 days, on the hope that if it's only once a year, we'll try not to take too much time out of school and other things. But at least that way there are a few more breaks built into it, and you can go off and go and explore shopping, because Birmingham is the European shopping capital. So you can go out even better than France. So than Paris. So if you can go that way, there's an opportunity for some breaks in it as well. Another feedback that we had from both this clinic and others is that young people would like somewhere to chill out between appointments where they know they're not going to get attacked by a doctor or a nurse for a blood test or a nurse for a research thing, and they can just go and talk to each other and have a cup of tea and do something else. And most recently, I think the last couple of clinics, Catherine, we've used the pod, haven't we, I think? It's a rectangular, it's an octagonal room in the research facility that's got comfortable chairs in it, and you can play music or an iPod and just sit and relax in that area and know that there isn't going to be a doctor that's going to come and attack you in that. So we're hoping to have that available for all the clinics coming, just to make things a bit more comfortable for young people as well. And then thirdly, through Marie, we heard that some young people, as they're thinking about going to the adult service, would like to visit the adult hospital first and get to know it a bit before being transferred. So Marie very kindly organised a visit to the Queen Elizabeth Hospital back in September for some of the young people, some of whom are here today as well, I think. And we went and visited, had a look at the surroundings, met Professor Morrison, got a cup of coffee from the Costa Coffee in the front, and then went upstairs and had a bit of a chat as well. So I hope that was helpful, and I hope at least when you do go to the adult hospital, it will be a little bit of a less scary experience. Susan, can you remember any other bits of feedback that we've had from that?
I think that was it, really.
That was it, right at the moment at the moment.
Yeah.
Okay. So, we're almost finished with these, almost done. We're trying to link with your local doctors, the schools, the blind colleges and the schools like the RNIB one at Worcester, the Vision Charities, Royal National Institute for the Blind and SEND, and your family doctors as well, to actually make sure that they know what we've advised in the clinic, and that if they've not sure how to look after people with this condition, we can then be a source of advice and referral for that. And we've also done a number of letters for school, for trying to get extra advice in school, and for adults, disability living allowance. And that's one thing that we should be able to try and help you with the new way that funding support is going, that if you're having difficulties accessing that, we should be able to write letters on your behalf, both adults and children, to help you access those things. So bear in mind that. And then finding social services to help as well. So we can do. So what have we learned from this clinic, Dr. Morris and myself? I think overall we've learned that there are areas in the country with really good local care and experts. And I was talking yesterday with some families with, for instance, Dr. Steve Ball in Newcastle is an absolute expert in salt and water balance for adults, and he's a really good expert in the North East to find. And I've got a colleague who's a fantastic expert at Great Ormond Street Children's Hospital, and there's another expert in the adult service in Bristol. So some local care is actually very good, and we're very fortunate. A lot of people have said they're very isolated, and they found that it's been very difficult not knowing anybody else or any other family with this condition. And I didn't appreciate really that how isolated this condition was before. I've met families who told me that. And one thing I hope we can get out of these clinics is helping you to interact with each other and perhaps make friends through the Well Child and Wolfram Syndrome UK and other people, so that you realise that you're not on your own with this condition. We are finding that some tests are being missed by local teams, and we've found a number of adults where perhaps hormone replacement isn't being done adequately, or that they're not being supported with either estrogen support or testosterone support or others. And some where the bladder problems are perhaps not being addressed as effectively as they could. And for those, we're trying to get some support through the local urology teams to address those. And then finally, we're finding that I thought I knew what Wolfram syndrome was before I started this, and I've realised after a year of doing these clinics that I don't know what Wolfram syndrome is. It's incredibly variable, and there's no common pattern that applies to everybody. And all I can conclude now is that everybody is quite different. And there's no pattern to say, this is what's going to happen for everybody. Everybody seems to be quite different through this. And I hadn't really appreciated that at the start of this service as well. So I think that's really important. Whatever you read in the literature, and whatever you read on the web, there is no common pattern for Wolfram. Everybody's quite different in the way that they follow things through. So that's the summary. So then I wanted to ask for your help, really. We've got an audit day on December the 4th, and our commissioners, the National Health Service, are coming to visit, and they want to know what have we done, and we will present and tell them how many adults and children that we've seen in the service, how many tests we've done, how many blood tests, how many genetic tests, etc. But we need to know what's worked well and what needs to change to improve. We have got a limited budget, and it's not going to get any more money because the health service isn't going to have any more money for that. But we would like to know what services you'd like to see in the Wolfram clinics at the Queen Elizabeth and at the Children's, And if you could change one thing in the adult service or the children's service, we really would like to know what that would be. And if you don't want to say here, that's absolutely fine. But if you want to tell Susan or Rachel or me over coffee, that's absolutely fine as well. Or if you want to do it anonymously through Rachel, that's also absolutely fine. But what I'd really appreciate is your thoughts about how you'd like to see the service evolve and what would be most useful for you in the future. Okay? So I'll stop at that for the moment, and I'll ask if anybody has got any comments they want to make or any suggestions that they've got at this stage.
I think the thing you said there, Tim, about being able to access other specialists if you give enough notice, because sometimes you that could short circuit something that, you know, if you have to try and do it locally, by the time you've got an appointment and you're not sure whether you see the right person. So I think that could be very helpful because of the variety, because, you know, your child could have something that nobody else has got and you don't know whether it's related to the Wolfram or it just so happens to be something that they've just unfortunately developed yet another thing. So that's really useful to be able to have that facility.
Any sorts of specialties you had in mind, for instance, were you thinking of?
Well, we're just saying when you're saying like our daughter also has celiac disease, which as far as I know isn't related to the Wolfram, but that does give her quite a lot of gastro issues. She gets quite a lot of reflux. She just can't eat very much sometimes. Sometimes we just know she just feels really ill all the time, and so it's just so, and you know how that impacts as it does. If you don't feel well and you're feeling sick through that, you don't really want to eat, which then impacts your diabetes, which all of those things. So those sorts of things are just someone else to just say, you know, yeah, that's probably what it is, you know, just some reassurance.
That's really helpful, because we have had a gastro doctor in the clinic before for another family, so that's really helpful to know.
I think probably just education in the wider medical field. I mean, Crystal was fairly advanced in age when she was diagnosed. I mean, we just, her being quite young at 4, developed all of these things. And had it not been for about 2 years ago or whatever, she had to meet 2 doctors in a hospital who said, wonder if this could be that we have found out. So she's had a huge percentage of her life trying to struggle through university and everything else with help that possibly could have been there that she hasn't had and we have not been aware of as her parents. So you kind of feel, not that she's missed out, but she could have had a lot of help a lot earlier on. And I think that's just about educating doctors, because the doctor that looked after Crystal for her ears had never heard of Wolfram. We didn't expect him to have heard of it, but he hadn't, and immediately started Googling, oh, what's this, you know? So I just think, I mean, we reckon we could have gone most of Crystal's life and never been aware of this condition. So I think it's, you know, to help people, sufferers, families, is how you can sort of find some way of early diagnosis. I think that's what I'm trying to say.
Well, I think if we're going to keep getting funding from the government for this, we have to show that diagnosis is getting earlier year on year. And that's quite hard to do, but we'll have to try and advertise the condition better to make doctors aware.
Yes.
Can I just ask?
When Kerry and I went to the clinic in Birmingham last year to have for the different people, and we had the skin tag taken for the research into helping stop the condition. Are we any closer to finding any solutions to stopping it, or to stopping it, the damage?
That's a really good question, Alex, and I'm very fortunate because I've got probably one of the leading researchers from France and the UK is going to come and talk, I think, after me about what progress they're making to try and stop the damage to do that. It's also about the skin biopsies that you very kindly donated and what research we're doing with that. So we haven't got all the answers today, but at least we've got hopefully some interesting research to present to you about how we're trying to stop the damage to do that. So we'll be talking about that.
Can I also found that the appointments in the afternoon were good, but we wondered whether you'd be able to do them in the morning, because I was finding big anxiety easily in the afternoon.
Okay. So the afternoon appointments is more tiring, is it? Yeah. Okay. That's exactly the sort of feedback, Kerry, that I need, and we need to have that. And I will mention that to Rachel. Perhaps you can mention to Rachel as well, because if we have enough feedback like that, we can then try and change the times of these.